There's a common misconception about aging, that feeling tired all the time, losing a little weight, forgetting things here and there, or needing to run to the bathroom more often is just part of growing older. But what if those symptoms were more than just normal aging? What if they were signs of something serious brewing silently beneath the surface? As we age, our bodies change, and not always in ways we can see or feel right away. The real danger lies in what we don't notice, the slow-building fatigue, that unexplained drop in weight, the frustrating forgetfulness. They creep in gradually, and too often, they're brushed off until it's too late. In this video, we're diving into 5 silent symptoms you should never ignore, especially after age 60. These aren't just random signs. They can be early warnings for chronic diseases like diabetes, cancer, heart disease, kidney failure, and even neurological decline. You see, the body whispers before it screams. The earlier we recognize those whispers, the better chance we have at staying healthy, independent, and full of life for decades to come. So if you've ever said to yourself, "I'm just getting older, that's why I'm tired," or "I must be eating less, that's why I'm losing weight," or even "everyone forgets things sometimes, right?" then this message is for you. Maybe you've noticed you're going to the bathroom more often, or you're getting winded just walking across the room. These signs may feel like small inconveniences, but they may also be your body's quiet way of warning you that something isn't right. Silent symptoms are dangerous because they don't feel urgent. They don't demand your attention the way sharp chest pain or a broken bone might. Instead, they fade into the background of daily life, slowly becoming your new normal. That's exactly what makes them so dangerous. The human body is remarkably adaptive. It can mask early dysfunction and push through fatigue and imbalance, especially with age. But eventually that catches up. There are 3 big reasons silent symptoms tend to go unnoticed. First, our bodies become more resilient to pain, but less responsive to dysfunction, especially after age 60. That means you might not feel the same intensity of warning signals you once did. Second, medications, even common ones like blood pressure meds or cholesterol-lowering drugs, can dull your awareness of underlying problems. And third, and perhaps most common, is the mindset that these changes are simply a normal part of aging, and therefore not worth mentioning to a doctor. But here's the truth. Getting older doesn't automatically mean feeling worse. Many health problems that begin with subtle symptoms can be treated or even reversed if caught early. So our goal today is not to scare you, but to raise awareness. When you know what to watch for, you can take action earlier, avoid complications, and protect the quality of your life. Throughout this video, we'll take a deep dive into each of the 5 silent symptoms. For each one, we'll explore what it feels like, why people often ignore it, what it might actually mean, and most importantly, what steps you can take to address it, naturally and effectively. This knowledge isn't just power, it's prevention. It could make the difference between catching a problem early or missing a critical warning sign until it's too late. So, stay with us. This is more than just health information. It's a roadmap for preserving your independence, energy, and longevity in the years to come. Let's begin with the first symptom, one that affects millions but is often dismissed as just life: persistent fatigue. Persistent fatigue is one of the most common yet most misunderstood symptoms in people over 60. It's more than just feeling tired after a poor night's sleep. We're talking about a deep, ongoing exhaustion that doesn't go away with rest. You wake up feeling like you haven't slept. You find it hard to concentrate. You lose motivation to do things you used to enjoy. Even small tasks like walking the dog, preparing meals, or running errands begin to feel overwhelming. Many people write it off as part of aging. They assume their body just doesn't have the same energy it used to. And that's partially true. But when fatigue becomes chronic and starts interfering with daily life, it's time to dig deeper. Fatigue can be the first sign of several serious conditions. It's often linked to anemia, where your body lacks enough red blood cells to carry oxygen. It can signal thyroid disorders, especially hypothyroidism, which slows metabolism and drains energy. Infections, autoimmune diseases, vitamin D deficiency, and even heart failure often present with fatigue long before more obvious symptoms appear. One of the most overlooked causes of persistent fatigue is undiagnosed type 2 diabetes. When your blood sugar is too high or fluctuates too much, it disrupts your body's ability to convert glucose into energy. This leads to constant tiredness, even after eating or resting. Similarly, sleep apnea, a condition where breathing pauses during sleep, is extremely common in older adults and can leave you exhausted even after a full night in bed. Depression is another key factor. Fatigue in older adults is often misdiagnosed as depression or vice versa, and in truth, the two frequently overlap. Depression can sap your physical energy just as much as your mental energy. If you're feeling persistently low and tired, it may not be just sadness. It may be something deeper, requiring both emotional and medical attention. So, what can you do if you're experiencing this kind of fatigue? First, track your symptoms. Note when the fatigue began, what times of day it's worst, and what seems to trigger or relieve it. Next, talk to your doctor. Ask for a full blood panel, including thyroid function, vitamin levels, and blood sugar. Don't accept "it's just aging" as a final answer. Persistent fatigue is never normal. Natural ways to boost energy include getting regular light exposure in the morning to reset your circadian rhythm, adding magnesium-rich foods like leafy greens and seeds to your diet, and staying hydrated. Don't underestimate the power of walking daily, even just 10 to 15 minutes. It increases oxygen flow, improves sleep, and can drastically reduce feelings of sluggishness over time. Next, let's move on to silent symptom number 2, sudden or unexplained weight loss. At first glance, weight loss might seem like a good thing, especially in a society obsessed with dieting. But for older adults, losing weight without trying can be a red flag. It often goes unnoticed because it happens slowly. Your clothes fit looser, or the scale creeps down a few pounds each month. But losing more than 5% of your body weight over 6 to 12 months without dieting or increasing activity can indicate something serious. Unintentional weight loss is often a first sign of cancer, especially cancers of the pancreas, stomach, lung, or colon. These types of cancers can cause metabolic changes that burn calories rapidly. Weight loss may happen before pain, fatigue, or any other symptom shows up. It can also signal uncontrolled diabetes, where sugar stays in your bloodstream rather than entering your cells for fuel. Your body, unable to access energy properly, begins breaking down fat and muscle instead, leading to unintentional loss. Chronic infections, like tuberculosis or HIV, though less common in older adults, are still worth considering if you've had exposure. More commonly, digestive disorders like Crohn's disease, ulcerative colitis, or even chronic gastritis can impair nutrient absorption, causing weight loss. Add in poor dental health, changes in appetite, or medications that suppress hunger, and it's easy to see how weight can fall without intention. In elderly populations, weight loss can even be linked to early dementia. Cognitive decline can lead to missed meals, disinterest in food, or trouble cooking. Depression is also a major contributor. People who are deeply sad or anxious may simply stop eating enough. So what can you do? First, don't ignore the signs. If you're losing weight without trying, even 8 to 10 pounds over several months, document it. Talk to your doctor and ask for screenings beyond a basic physical. Blood work, stool tests, thyroid panels, and abdominal imaging may be necessary. Nutritionally, aim to eat small, frequent meals with a balance of protein, healthy fats, and complex carbohydrates. Bone broths, smoothies, and nutrient-dense snacks like nuts, eggs, and avocado can help. And if appetite is the issue, herbs like ginger or bitter greens can help stimulate digestion naturally. Now let's turn to the third symptom, and this one hits close to home for many families. Memory loss. We all forget things from time to time. Names, appointments, where we left the keys. But how do you know when memory loss is more than just a senior moment? How do you recognize the early signs of something more serious, like dementia or Alzheimer's disease? Memory loss becomes concerning when it interferes with daily function. Forgetting a recent conversation, repeating questions, getting lost in familiar places, trouble following steps in a task you've done 100 times before. These are not harmless lapses. They're potential markers of cognitive decline. The first thing to understand is that mild memory issues don't always mean Alzheimer's. They could be caused by medication side effects, poor sleep, vitamin B12 deficiency, depression, or thyroid dysfunction, all of which are treatable. However, when memory loss is progressive, persistent, and paired with changes in judgment, mood, or behavior, it's critical to seek evaluation. Early detection of cognitive impairment allows for better planning, treatment, and sometimes slowing of the decline. Natural ways to support brain health include regular mental stimulation, puzzles, reading, learning new skills, and physical movement, which boosts blood flow to the brain. Diet plays a huge role too. The MIND diet, a blend of the Mediterranean and DASH diets, emphasizes leafy greens, berries, nuts, olive oil, and whole grains. Omega-3 fatty acids from fish or flaxseed support brain cell health, and herbs like ginkgo biloba and Bacopa monnieri have shown promise in improving cognitive function. Let's continue to the fourth silent symptom, one most people ignore until it becomes disruptive: frequent urination. Having to urinate more often, especially at night, may seem like a minor annoyance, but it can signal blood sugar problems, kidney dysfunction, or an enlarged prostate. For women, it may be linked to hormonal shifts, pelvic floor weakness, or bladder infections. For men, it can be an early warning of prostate issues. The most common and dangerous reason for frequent urination, though, is undiagnosed or poorly managed diabetes. When blood sugar is high, your kidneys work overtime to filter the excess, producing more urine and causing dehydration. This leads to a cycle of drinking more water and needing to urinate again, especially at night. Kidney disease can also present this way, especially in the early stages when there's no pain or swelling yet. Left unchecked, kidney dysfunction can lead to dangerous electrolyte imbalances, anemia, and even heart complications. You should talk to your doctor if you're urinating more than 8 times a day, more than once or twice at night, or if you notice a sudden increase in urgency. Blood work and urine tests can assess kidney function, blood sugar levels, and possible infections. To support urinary health naturally, reduce caffeine and alcohol, both of which are diuretics. Practice pelvic floor exercises like Kegels, which can help both men and women. Herbs like saw palmetto for men and cranberry extract for women may support urinary tract function and prevent infections. And finally, we come to the fifth silent symptom: shortness of breath. Feeling winded from walking a short distance, climbing stairs, or even talking too much isn't normal. Even in your 60s or 70s, shortness of breath, or dyspnea, is often a sign of heart or lung issues. It may be related to heart failure, where the heart doesn't pump blood efficiently, leading to fluid buildup in the lungs. Chronic obstructive pulmonary disease, COPD, often caused by smoking, can also present with subtle breathlessness. Blood clots, anemia, anxiety, and even arrhythmias can cause this symptom as well. The key is to notice when it occurs. Is it triggered by exertion, or is it constant? Is it paired with swelling, fatigue, or a cough? These clues can help your doctor make the right diagnosis. Never ignore shortness of breath. It is one of the most common early signs of a cardiac event, including silent heart attacks, especially in women. If it's sudden, severe, or paired with chest pain or dizziness, seek emergency help. To support respiratory and heart health naturally, focus on gentle aerobic exercise like walking or Tai Chi, deep breathing techniques, and a diet rich in anti-inflammatory foods like leafy greens, fatty fish, and berries. Quit smoking if you haven't already, and avoid exposure to indoor pollutants. Now that we've explored these 5 silent symptoms: persistent fatigue, sudden weight loss, memory loss, frequent urination, and shortness of breath, it's time to bring it all together. These signs may seem subtle, but they can be the early warnings your body sends before something more serious takes hold. The earlier you act, the more options you have. Don't wait until symptoms become unmanageable. Track what you're feeling, talk to a qualified professional, and take small but consistent steps to improve your health daily. Knowledge is your first line of defense. Lifestyle is your medicine. And action, early action, is what turns potential problems into manageable conditions. If this video helped you understand your body better, give it a thumbs up, and share it with someone you love. You never know whose life you might impact just by spreading awareness. And if you haven't already, subscribe to this channel for more practical, empowering health content created especially for those of us over 60 who still have so much life ahead of us. Stay informed, stay active, and most of all, stay curious about your own health.